Hi everyone. Today we'll see continuation of that health assessment topic. Today we'll see health assessment of infant. Children below 1 year of age are called infants. Mother has an important role in the health assessment of the infant. In the absence of mother, these can be obtained from the other responsible parent. The important constituents of health assessment of the infant. It is past medical history. In past medical history, we should collect general health and strength of the child and how is the mother health during the pregnancy and the history of the birth and history of neonatal stage and how was the feeding how baby used to take bottle feeding or breastfeeding or present feed and position of hunger or food preference, eats himself or not, finding the age of weaning is also essential. And we should collect the history like immunization. They took the immunization or not. They, if after taking of immunization, any adverse uh, adverse effect affected or not, we should see. Then communicable diseases, accidents, or any other diseases was the child admitted in hospital. If yes, then the duration and the details of the treatment given. We should ask regarding any accident or any communicable disease which has happened in the past. We should collect that history. And next, will see assessment of development. Here, we should check the head and chest circumferences, weight and height of the baby, developmental milestones, for how many months baby head is controlled, or rolling over, sitting without any support, or standing with support or without any support, walking with support or without support, speaking words, eruption of first tooth, toilet training. All this history we should collect in assessment of development. Next, we'll see family history. Here, we should confirm we should collect all the information regarding the family like personal, financial, social, domestic, educational and nutritional condition of the family. It should be obtained from the mother or any other guardian because these have direct or indirect effect on the health of the infant. Next we'll see present illness and chief complaint. Here, the attempt is made to find out the present illness and main complaint of the child or from for what the baby is suffering. We should collect. And next, review of system. Here a detailed checkup is done of all the systems for the infant. Special attention should be paid to the following in the health checkup of the infant. Like presence of pediculosis or any other skin diseases or any ear discharge is there or not, excessive running of nose, breathing from mouth or other allergic condition. All these things we should see. And this health assessment of the infant is multifaceted process for which community health nurse should have special skills and capabilities. Active support of the mother or guardian of the infant is also necessary. Next, nutritional status. The growth chart monitor the growth of the child over this period. It will detect early onset of malnutrition and also indicates to what degree is the child malnourished. PEM is classified by using Gomez classification. Here we can see assessment of nutritional status Gomez classification, weight for age in percentage. For 91 to 100%, if you are seeing malnutrition is normal, means the baby is normal. It is not, the baby is not malnourished. If you are seeing 76% to 90%, it is in first degree of malnourished. If you are seeing in from between 61 to 75%, babies in second degree of malnourished. If their baby is below 60%, the baby is third degree in malnutrition. These things we should collect. And next, developmental assessment. This is checked as per the milestones in child's life and is compared to normal. Major milestones of development. Milestones. uh, Age of achievements. In the month of 1 to 2 months, if the baby talking, taking notice of smiling, if the baby started noticing the persons or things, or started smiling in between 1 to 2 months, means the babies achieved the things. Head control in the third 3 to 4th month, in between that period, the baby's head got control, means it is the baby age of achievement is completed. And in the month of 4 to 5th month, rolling over, the baby roll over means that it is achieved. And sitting without any support in the month of 6 to 8 months means the baby achieved. And walking with support in the month of 12 to 18 months, with or without support, it is achieved. And next, speaking simple sentences uh, in the month of 18 to 24 months, the baby age of achievements are achieved. Next, this this is regarding health assessment of infant. Next, we'll see health assessment of preschool child. Preschool going age 1 to 4 years is that period in child's life when intense growth and development takes place. That is the different period where the baby gets different feelings, and in his or her vaccination is also complete during this period. And this during this age, children can suffer from dehydration, diarrhea, malnutrition, and infectious diseases. Because this is like vulnerable group they were in, following components can be included in the health assessment of children belonging to this age group. uh, like past medical history of a child, we'll see then personal and family history of a child, then various health checkups related to the growth and development of child, immunization status of child, nutrition level of child and his eating habit, means dietary pattern. Next, present condition of child's health and his major health problem. If there any major health problem, we should assess that. And next, lastly, head to toe physical examination of child and review of all systems of this body. We should check this. This is regarding health assessment of preschool child. Next, health assessment of school child. Health assessment of school going children is an important part of school health service. Along with community health nurse, physician, and teachers also share the responsibility of this assessment. The components of health assessment of school going children are: first one, periodic checkup of children. Here, when during admission time, uh, once they'll check up the baby and they'll take admission of that baby. And next, health checkups of child fourth year. Every fourth year, they'll check the baby's health. And when baby is going to leave that school, when means check up at the time of leaving the school, once they'll check. In between that, up to 4 years, every time they'll check um, height, weight, and dental, eyes, hearing, abdomen, urine, blood, everything they'll check and they'll observe, they'll collect. Next, nutritional assessment. This includes assessment of food child gets at home and the supplementary meals given in school. Whatever the food baby is getting from the home and what extra meals the baby is getting from the school, that also you should ask. Next, daily examination. Daily examination of child is conducted by the teachers. For this, it is essential that the teachers be trained in diagnosing the illness and providing routine treatment. During daily examination, it is necessary to keep an eye on the cold, cough, headache, skin diseases, and other infections. So, everyday teacher should observe the children. And next, personal and family history of children. Here, history can be collected through parent teacher or parent community health nurse. Meetings held at the time of admission in the school or later from that later from time to time, which is desirable for health assessment. Next, past medical history. For the baby, if there any past medical history, we should ask any procedures is under any procedure baby is there or not, that we should ask. And any extra treatment or any extra care baby is getting, that also we should know. Then the teachers, parents, community health nurses, and doctors, etc., shall share the joint responsibility of the health assessment of school going child. Here, it is necessary to clarify that a comprehensive record of all the facts and information gathered from health assessment should be documented in the health card of the child. Whatever the changes is there, everything, the teachers or parents or in community health nurse, doctors, they should mm, maintain a record of that particular baby's medical condition. This everything we should collect. Next, health assessment of adult. Adulthood of a person can be determined on the basis of his age and level of maturity. Attaining the right to vote after the age of 18 years is considered to be beginning of adulthood. Adulthood can be divided into three parts: young adults means the age between 18 to 40 years, middle aged adults means the age between 40 to 60 years, elderly adults, the age above 60 years. For these peoples after the 18 years of age will consider as adults. Next, this complete physical checkup and history have an important place in the health assessment of an adult person, since complete physical development and stability achieved in this age. It is essential to pay attention on the following steps on the assessment. First one is psychological development. Next, cognitive development. Next, moral and spiritual development. The young adult should have his own psychological development, cognitive development, moral and spiritual development, and health protections like accidents, infections, suicide, sex related problems, drug addiction, obesity, blood pressure, and mental disorders are the major health hazards of adults. It is necessary to pay attention to these in the health assessment of adults. This is regarding health assessment of adult. Next, health assessment of aged persons. Um, Old people may habitate to live with the disease as they believe that now there is no remedy for it, or they may think that complaint will make others to ignore them, or the complaint of pain may be unbelievable in most of the cases because there may be a change in their attitude about the feeling of pain. Behavior of family and society towards aged persons plays an important role in their health assessment. Here are the important constituents of health assessment of aged persons in the above mentioned context. Assessment of disabilities. The old age, the old persons may be suffering from physical, psychological, social, and sexual disabilities or impairments. They may experience problem in movement, sitting and getting up, climbing the stairs, opening the jar or box, holding the small objects, stretching to reach the objects kept above the level of their head and maintaining balance, etc. Similarly, cooking, domestic work, shopkeeping, taking medicine, managing money, and conducting daily living activities, going to toilet, having bath, changing clothes, taking food, etc. For all these things, the elderly people they may feel it is difficult and they may depend on others. Therefore, old people need much more social protection and support. Next, past medical history. For the old age person, we should see any past history like uh, any injuries or any diseases uh, like measles, diphtheria, blood pressure, diabetes, heart diseases like this, any past medical histories there we should see, or any surgery or serious accident that also we should observe, or allergy and emotional level also we should see. Then general health and strength of the patient that we should see. And the previous treatment what patient got for what and how it is reacted to that particular patient body that we should see. This is regarding past medical history we should ask. Next, personal and family history. Here, attention is paid to the place of birth, domestic environment, marriage, divorce, socioeconomic group, education, cultural background, position of family, interests, and different aspects of general life. We should compare the personal and family history, how that particular person is behaving in his family, how he is showing his emotions in his family, and how he is ready to take the responsibilities, and how he is balancing his personal and family life togetherly. And for religious beliefs also, and to maintain finance also. Everything we should ask in this personal and family history. Next, review of systems. Though head to toe physical examination is desirable for correct assessment, but it is not necessary to review all the systems every time. Through physical examination, the health status can be assessed by examining all the vital organs and systems of the body. Here it should be remembered that old age is called the home of diseases. Hence, the results of this examination help in determining many diseases or health problems. Means by seeing old age home or old age people's house, one or other diseases we can get, but we can't predict that all the times all the systems will be affected. So this is regarding review of system. Next, present illness. What is the present illness of the aged person, and what is his problem, and how he is very with the other person, and how he is taking treatment, what is the main problem because of what he got ill, that we should see in this present illness. Next, chief complaints. While assessing the health of old people, the chief complaint should be inquired so as the priorities may be decided in the implementation of care. So these are all the things we should collect for aged persons to assess his health. And next we'll see antenatal health assessment. Right from the time of confirmation of pregnancy, antenatal health assessment of the pregnant woman begins. The most important objective of antenatal health assessment is to find out the physical and psychological response of the pregnant woman towards pregnancy. We will see components of antenatal health assessment. Taking medical history, means collecting data collection, and antenatal assessment means collecting medical history, like history regarding menstrual cycle. At what age she attended the menstrual cycle, and how is the regularity of that menstrual cycle, and any complications regarding that menstrual cycle. Those things we should ask. Next, just obstetrical history, like any previous pregnancy, at what date she got delivery, and any post delivery experience, and what is the age, sex, birth weight of child before what she gave birth, that first baby, or before what, mm, before existing pregnancy, uh, which baby she delivered, and we should ask health condition of former child at present, and we should ask present pregnancy, how it is planned or unplanned or unwanted pregnancy, or the signs or symptoms of this pregnancy, everything we should ask. And next, personal and family history also we should ask, like what is the social history of that family and educational standards of woman and her husband. What no, Next we should ask the marital and sexual history, occupation and pregnant and her husband. mm, Means occupation of pregnant woman and her husband occupation we should ask. Habits related to exercises, rest, sleep, food, recreation and elimination. Lastly, general status of health, everything we should ask in medical history. Next, physical examination. General examination, measuring weight and height of the pregnant woman, taking TPR, means temperature, pulse, respiration, blood pressure, and pulse oximetry to the particular woman. Next, gynecological examination. Firstly, examination of breast, then examination of abdomen and palpation, and lastly, vaginal examination if necessary. Then, laboratory examination. Laboratory examination are done according to the physical condition of the pregnant woman. Some important ones are like testing hemoglobin, WBC, and DLC count, blood group, RH factor, urine examination, Papinicoleum smear test, means PAP test, PAP smear test, blood sugar test, blood serum examination, ultrasonography, chest X-ray if necessary, stool test. All these tests we should do. Next, monitoring of growth and development of fetus. For examining the growth and development of embryo or fetus in the womb, the pregnant woman should be called to the clinic in the following manner, like once a month till up to 30th week of pregnancy. Once a month she should visit. From 30th to 36th week, every 15 days she should visit. After that, till pain start, once every 7 days she should visit the hospital. Then, it's the next, detecting risk of pregnancy. Detecting the high risk pregnancy. High risk pregnancy can be assessed on the basis of the following factors. Age of the pregnant woman, is it is below the 15 years or above 30 years, that we should see. Or multipara pregnant woman, or malpresentation or anemia, more than one baby in the womb, pre-eclampsia or eclampsia, antepartum hemorrhage, longer period of gestation, is 2 weeks or more than the due date of delivery, hydroneus, uh, height of the pregnant woman is less than 140 centimeters. All these things we should ask in high risk pregnancies. This is regarding antenatal health assessment. Then we'll see lastly postnatal health assessment. Generally, till 1 year of delivery, the mother's health is assessed. In case of normal delivery, the nurse should make 4 home visits, including first visits to the clinic. The visits can be increased according to the situation. In the postnatal health assessment, the child's health is to be also assessed along with mother's health. The woman gets psychological support if her anxieties regarding the health of the baby are eliminated, and she would be more cooperative in her own health assessment. Uh, Components of postnatal health assessment. First one is physical examination, laboratory examination, finding out psychological responses. Firstly, we'll see physical examination. The objectives of postnatal physical examination are collecting data regarding this postnatal uterus involution, assessing the needs of the lactating mother, and providing health education to the mother and the family members. The main points of physical examinations included general observation. During the entire period of physical examinations, we should observe the we should observe mother's condition, notice the posture, facial expression, etc. are to be made. Then examination of vital signs, because after delivery of the woman's temperature, pulse, respiration, and blood pressures are to be measured. Because of the labor, temperature may be little rise after delivery, but pulse rate may decrease. Pulse oximetry may be taken according to need. Remember, uh, because of labor, temperature may be little raised after delivery, but pulse rate may decrease. Next, abdominal examination. Because of the prolonged distension of abdominal muscles during pregnancy, these may become weak or loose. After delivery, the muscles can be brought back into its original position with proper exercises. Next, breast examination. Breasts may become heavy due to lactation. The child should be put to breast as early as possible. Heaviness of breast can be reduced by early breastfeeding. Nipples also need keen examination. Next, uterus examination. During puerperium, several retrogressive changes takes place in uterus. After delivery, the size of the uterus is about the size of head of the baby. In 6 to 8 weeks, it recedes into the pelvic cavity. Decidua forms layers inside the uterus in 1 to 2 days. The outer layer secretes lochia. The secretion is red in the beginning, then changes to pink color, and later becomes white. See this lochia, the secretion is red in the beginning, then changes to pink color, and later becomes white. During puerperium, vagina, uterus, cervix, and perineum regain their tone. This is regarding uterus examination. Next, urinary bladder examination. Just after delivery, there may be a swelling in the urinary bladder. Its capacity might increase, but sensitivity decreases. Its capacity might increase, but sensitivity decreases. In order to avoid expansion of urinary bladder, the woman should be encouraged to urinate. Next, pelvic examination. Any abnormality after 6 weeks of delivery, like tear, injury due to episiotomy, etc., can be detected only by pelvic examination. This is regarding physical examination for the postnatal woman. Next, laboratory examinations like blood examinations to detect anemia because loss of the blood during pregnancy. Next, urine examination. Next, sonography if necessary. Next, we'll see finding out psychological responses. First one is uh, developmental approaches, like the mother, she should accept the baby, and she should realize that discomforts of pregnancy and this no labor pain and delivery is real, and she should feel that, and regaining physical and mental strength whatever she is, and she should regain, learn to take care of newborn. If she is not having a practice, she should learn that time, and re-establishment of domestic life, establishing family relationship with the baby. The depending phase. For a few days after delivery, the woman is dependent on the assistance of other people. Means she need help from other person. How long she will take to become independent? Depends upon the nature and experience of the woman. Emotional ups and downs may be observed during this period. Dependent phase. When she is depending on others, her emotions, ups and downs may be observed during this period. Next, bonding with infant. Mother gazing at the infant steadily with loving eyes, hold its head close to herself, etc., shows her affection for the baby. Means she should show the affection to the baby, she should show love, and then the baby will start making bond with the mother. During this stage, father and other family members, especially children, find satisfaction in touching the baby, seeing it or assessing it in its care. And lastly, adverse responses. In some instances, when the child is unwanted or it was born out of some compulsion, the mother's responses to the child may be of anger, hatred, or rejection. In addition to above mentioned points in postnatal health assessment, rest, sleep, nutrition, excretion, personal health, etc., are also be included. So this is regarding finding out psychological responses. Thank you.